I'm Dr. Jason Bowlds. I'm a general surgeon, and every week I try to bring you videos discussing topics on the treatment and prevention of abdominal diseases. Today's topic is on abdominal wall hernias. So what is a hernia? A hernia is simply a hole in the abdominal wall musculature through which the intestines can protrude and or become trapped. There are several types of hernias, but the main types are ventral or incisional hernias, which occur in the front of the abdominal wall or through old incisions after surgery. The second type are groin hernias or inguinal hernias, which usually occur more often in men. How does a hernia become symptomatic? As you are on your feet or lifting throughout the day, the abdominal contents can push through this and become uncomfortable or even trapped. If you are having severe pain in the area of a protrusion or known hernia, if this pain lasts more than several hours, or if it is accompanied by nausea and vomiting, then you need to seek advice from a medical professional immediately or go to the emergency room. Historically, how have we fixed hernias? Decades ago, especially before the 90s, most hernias were fixed in what's called a primary fashion. In order to do this, an incision was made over the hernia site and the muscles were stretched together. These were then sutured closed. Because of the tension involved, a fair amount of these failed or occurred over several years period. Since the 90s, most hernias have been fixed with mesh. Mesh is a plastic material, usually of polypropylene. It looks like a screen on a window. And once the muscles are repaired, it is reinforced with the mesh. And with a mesh repair, the recurrence rate is usually much less. Mostly because of television and lawyer ads, some people are fearful of having mesh placed. But the vast majority of hernias are nowadays fixed with mesh. There is very little risk of rejection or reaction, and the only real risk is that mesh is a foreign body, and if it ever gets infected, it has to come back out. The risk of a mesh infection during hernia repair or after should be well under 1%. So now we'll talk about the different ways that a hernia can actually be repaired. The first is what's called an open repair, where an incision is made over the area of the hernia and the muscles are repaired and reinforced with mesh. The advantages of this type of repair are that it is historically the standard repair and most general surgeons know how to do it. It also has the advantage that it can be done under local or spinal anesthetic if you have medical problems or that you're at an age to where general anesthetic could be dangerous. The disadvantage to this type of repair is that because the incision is right over the area of the hernia, there is an increased risk of wound problems and mesh problems. Also with this type of repair, your recovery can be up to 6 to 8 weeks of no heavy lifting. The second type of repair is called a laparoscopic repair. This is usually done through 3 or 4 small incisions at a site away from the hernia, and the muscles are fixed from the inside and reinforced with mesh posterior to the muscles. This is considered a much stronger repair, and the advantage is because the incisions are small and away from the mesh, there is less likelihood of wound problems or mesh problems down the road. It also decreases your recovery time from lifting from 6 to 8 weeks to 3 to 4 weeks. The disadvantage to this type of repair is that it does require general anesthesia. And even though small incisions are involved, the pain is not necessarily less than an open repair. Lastly, there is what's called a robotic repair. This is a modification of the laparoscopic repair, and the main advantage it is because of the technique used. Not only is there decreased risk of recurrence of the hernia down the road, but there is much less pain and swelling in the recovery period after surgery. Just like with laparoscopic, it does require general anesthesia. It is also somewhat more expensive, and depending on where you have it and your insurance company, you want to make sure you check with your insurance company beforehand to make sure they pay for this. The risks of hernia surgery are the same with any abdominal surgery. There's always a small risk of bleeding and infection and a possibility of bowel injury. There is also the risk of anesthesia, especially if you have multiple comorbid conditions. If you are older or have multiple medical conditions, you might be better off with an open repair under local anesthetic. The recovery after hernia surgery is usually followed by 1 to 1.5 weeks of discomfort or moderate pain. After this time, you can resume light-duty work at any point that you wish. If your work involves heavy lifting, especially anything over 20 to 25 pounds, remember that there is an extended period where you can't lift anything. For open surgery, this is 6 to 8 weeks, and for laparoscopic or robotic, this is 3 to 4 weeks. After that, you should be fully recovered and can resume any heavy duty. Just remember that any hernia, regardless of technique, can always come back. Your risk of recurrence is increased if you're diabetic or overweight or a smoker. If you chronically lift heavy things with your job, you also put yourself at risk as well. So I hope this topic of hernias has been helpful to you. If so, please hit the subscribe button below. And in the comment section, please add any topics that you would like to hear more about in the future. As always, I'm Dr. Jason Bowlds, bringing you better health through better education.